We want you to enjoy this. Please feel free to participate via chat. And I want to get us started because I'm really excited about this conversation and the distinguished panel that we have been able to put together. So I want to do brief introductions for the panel. We have, in no particular order, we have Dr. Jennifer Bradford, who is family medicine specialist in Worcester, Massachusetts. She has 10 plus years in serving diverse communities and also just having diverse experiences, especially in family medicine. She is currently part of UMASS Department of Family Medicine and Community Health. We have Counselor Christian King, who is currently serving his third of 2-year term as counselor at large in the city of Worcester. In another world, he is a social worker with the state's Department of Children and Family and an ardent advocate for those underserved populations. We also have City Councilor of First District, District 1, Sean Rose. He is, in his other life, President and CEO of Thrive Support and Advocacy, a nonprofit agency serving developmentally disabled children and adults. He is also founder and owner of Point School, a young adult gap year program in Puerto Rico. Bill Gardner is a resident of Worcester. He has lived here 50 years, the last 50 years of his life. He is a former Worcester police officer. He's also a photographic artist and educator. Most recently, he's been doing homework help and STEM education for the Angels Net Foundation's after school program. And Angels Net is a local African refugee and immigrant agency. We also have Craig Mortley, who has been involved in applied social work for the past 5 years, providing direct services to families experiencing domestic violence, as well as facilitating education. He has been engaged in policy advocacy and participates in local working groups on racial justice, diversity and inclusion, belonging, integration of immigrants, and improving health outcomes for marginalized, vulnerable populations. He is also a recent graduate of Leadership Worcester. Bonetta Kofer is a resident of Worcester, involved in various community activities. She is currently a board member for Central Mass Council on Aging. She volunteers for AARP and is currently recovering from COVID-19. And she is very concerned about the disproportionate impact the virus is having on the Black community. Which brings us to our topic of discussion this evening. So part of what prompted this discussion, or all of what prompted this discussion, is the disparate impact this virus has had in what I would say is vulnerable, underserved communities. And so across the country, we are seeing the impact, whether it's my hometown of St. Louis, Missouri, where the first 12 deaths attributed to COVID-19 were all African American. Are places like New Orleans that are seeing huge numbers, in Detroit, of African American folks who have been impacted by this virus. And there's all sorts of reasons that some of us are familiar with why that may be the case. So we kind of want to start the discussion this evening around what are those reasons that commentators, strategists, health providers, activists are seeing or talking about that may impact the African American communities in a different way. Now, I do want to, we have terminology. So I'm saying African American. In the advertisement, we said Black community. And so that's all inclusive here in a place like Worcester, unlike, again, my hometown of St. Louis, where there's a clearly defined African American community. We've had quite a mixture of brown and Black folks in Worcester. So I'm going to use Black to be all inclusive of anybody with highly melanated skin in Worcester that are readily identified. You all help me out if you want to comment, but readily identified as Black, because even that is very political in how we are naming people. And so when I see 21,000 and some odd number of African Americans on the census in Worcester, it says African American or Black. So I want to speak to that, and I think a lot of those social determinants that we're going to talk about may apply to the Black community in general. So I want to, if I can, so I want to talk about what hasn't been very clear is what's the data, what's the numbers, what are we talking about? I just keep hearing a disproportionate number. In some cities that have had more resources or started collecting a little sooner, like New York, in Chicago, there are some numbers coming out. But I want to go to Counselor King. Can we start with, and Counselor Rose, I want you all to talk a little bit about what do the numbers look like? What do we have in place? What are we starting to see? And do we have the right people in the right place at the right time collecting the data? And Counselor King, I know you introduced a motion a few weeks ago to say we need to collect this data on race and ethnicity. So if Counselor King, you want to go, and then Counselor Rose, I want you to follow up and tell us a little bit more about the data collection.
Sure, thank you. First, I certainly appreciate the Black History Project and the YWCA and others for supporting this important dialogue that we're having. I wanted to say that this obviously it's an issue that's nationwide, statewide, citywide, region-wide, and it's just so extremely important. When I introduced a couple of motions, the first one was back in April, just asking that the manager provide the city and the Board of Health with race and ethnicity statistics pertaining to COVID-19 for the purpose of advancing health equity in the city. Then I had a second follow-up asking for that information to be shared bi-monthly after the manager announced that there was a partnership between the City of Worcester and UMASS Memorial Medical Healthcare to collect that information. I spoke with the manager earlier today, and that's still in process. So I don't have the exact numbers for Worcester. I can say that when I filed that order, anecdotally, Dr. Garcia, who was working at the time, called into the council meeting and indicated there was around 50% of folks in the homeless shelters were people of color. I know that there is some statewide statistics, and those were saying that there's maybe 10% or so, and that was in the beginning. They were just beginning to track this, but we know this is certainly important in order to inform practice, to provide the evidence-based research that will help us lift us out of this. And also very, very honored to be a part of fighting against the local health community health facilities shutting down. We had the one over in Plumley Village. We had another one, I think a CHL, that shut down. We know that the challenges that folks have around insurance, around the implicit biases that come out through the exchange between the client and what have you. But we're certainly right in the midst of this. I'm in the process of working with the city to identify part of the purpose of that is to try to identify hotspots or regions or areas in the city where perhaps those numbers are higher than others. And I think we have a ways to go, and just continue to follow up with that. So, something that's on our radar.
Thank you. Thank you for introducing that motion. Councilor Rose.
Yeah, absolutely. I again, as Councilor King referenced, I appreciate you all having me on. I appreciate you reaching out to me, Bill, and including me in on this project. It means a lot to me to be able to share my opinion and my point of view, and to really speak on behalf of ways by which the council and Councilor King and I are advocating on behalf of the African American Black community. I think Councilor King was really spot on when he shared with our governing body that the data that was coming out of the state just wasn't going to be enough. Typically, all towns and cities right now are getting their data through this MAVEN system that is on the mass.gov site through infectious disease. Councilor King kind of got us all in the mindset that we weren't going to be satisfied with that vague data and that we needed to break it down on a more granular level. As a result of that, Dr. Hirsch and the city manager and others made a memorandum of understanding with UMass, who was conducting research on this on that granular level in hopes that they would share that with us. My understanding is that they're in the process of finalizing a memorandum of understanding and around that. We're a council up to this point, the most diverse council in the city's history. who has been really forward thinking and energized about taking care of our vulnerable populations. You referenced Councilor King and I's background, social worker, mental health. I mean, this is what motivates us. This is why we got into this thing, this political thing. So, I think that there is a lot of good information that we have as a result of our CHIP, our Community Health Improvement Plans. That was a grant that came through the CDC many years ago. Many community partners have come together to address issues in the CHIP. There's 3 principles and 9 primary focus areas that there's a lot of synthesis between the numbers that we're seeing in the African American and Black community right now, in terms of the challenges that they're seeing in the CHIP and the areas they're trying to address in the CHIP. There's a lot of congruence there with what we're seeing in terms of the numbers coming up as in the COVID positive cases. In talking to Dr. Hirsch this morning, our medical director, he couldn't give me any finite detailed numbers because they're constantly evolving and ever changing. But as of this morning, he had mentioned to me that African American Black community, that 12% of Worcester's COVID positive folks are African American Black, and that there are 32% in the Latinx community of all of our cases are positive. And so to Councilor King's point, I don't want to belabor it, identifying these hot spots, addressing some equity issues, access issues, and so on, health issues, health discrepancy is just going to go a long way in addressing this pandemic in the short term and some of the larger issues that chip in the long term.
Wonderful. Thank you. I see one of the audience members says, so are we to understand that we're at the very beginning of this data collection, and although this pandemic, this virus is new to all of us, it seems like we've been in the house forever and we're wondering why is this just now happening? It's my understanding that there's a committee has been formed to kind of take a look at this. Do we have any updates on that? Where are we with who's on the committee? Where are we at in the process of that? How long will it take to collect the data?
Well, one of the things, Debbie, to keep in mind is that in order for the research to be released, it needs to go through the internal review board. And so we don't know what that's going to look like. I'm not aware of who this committee is comprised of. The last I heard, they were, trying to look at keeping it inclusive to all, but at the same time, recognizing that a lot of our committees that get too big, it takes a little bit longer to get drilled down to some of the work. So I don't know if Councilor King has any more insight into who exactly.
Yeah, I certainly appreciate the question. I think, bringing this issue forward in April was certainly to make the public aware that, elected officials are in tune, and that we're pushing government to address this. As far as this task force or this group or whatever, however they're framing it is, we know that we're in a time where every minute matters. We're talking about people's lives. This is not, and I know I'm preaching to the choir, to the folks that are on the call most likely, but this isn't new information. We've been aware about this disparities and inequities and social determinants of health for quite a long time. And the fact that this has really kind of put it forward, we've had to have this type of loss of life concentrated in our communities, for it to be a focal point is unfortunate, but that's where we are. And I don't have exact date as far as when that started, but again, I just got a phone with the manager, and I'm really going to be pushing this over the next week or so to get the information that we need. And I'm not into symbolism at all, but it is important to know, to get the information out, that we as a city value and understand the challenges that people who are of color. I had amended my order to include folks who, to include people who fit a certain socioeconomic profiles, so folks who are in poverty. Those are the folks that are the low wage earners. Those are the folks who are called the core workers. They won't necessarily call them, essential, but they're the core workers who are out there. Those are the folks without, leave time that they can afford, and and trying to balance everything. So, I understand the urgency of this, and look forward to working with my colleagues to push it forward.
Great, I appreciate that. And we may get back to that because people have a lot of questions, or some have some answers. Many social and political commentators have noted that Black people have more underlying medical conditions and poor lifestyle choices that have created disparities in how COVID-19 affects the population. Sometimes what's not taken into that analysis is the very real virus of racism. Dr. Bradford, if I can get you into this conversation a little bit, can you tell me, in your opinion, what are some factors that may be fueling the disproportionate number of Black people being infected or testing positive, and in fact, some dying from COVID-19?
First of all, I'd just like to thank you for asking me to be a part of this panel. I think this is a really important discussion. And so we've already started to talk about some important factors. We're talking about the social determinants of health, and I think it's really important to talk about that within the context of COVID-19. And so the social determinants of health are those conditions under which we live, we're born in which we work. And so it's no coincidence. And some of the factors of social determinants of health that we look at are education, socioeconomic status, access to healthcare. And so all of those things are all things that play into the disproportionate amount of people in the Black community getting COVID-19 and dying from COVID-19. But it's not a coincidence that it seems as if the Black population have these underlying, medical conditions that's leading to the morbidity and mortality of the community. And so we have to think about, well, what's really driving this? And I think we need to talk about racism. And so when, I think about racism, I like to frame it around Camaris Jones's 3 levels of racism: the institutionalized racism, personally mediated, and internalized. And I know a lot of times the conversations that we have about these issues sit at the personally mediated, the personally mediated racism level, and that's when we talk more about kind of it's more of a blatant racism, like the prejudices and discrimination. But I think we need to have a higher level discussion to talk about the institutionalized racism. What are the factors of oppression that are happening within our communities that's causing us to see a disproportionate amount of Black people and just people of color getting COVID-19 and dying? And some of those factors are the fact, again, individuals are living in poverty. They are essential workers, and so they have to go into their jobs and risk the potential exposure to COVID-19. And then they may be going to homes that are multi-generational homes, or homes that have, many people in those homes. And so those essential workers are actually bringing the disease back into the homes. And so that's contributing to the high levels, I think, of Black people getting and dying from COVID-19. We have to just think about, a lot of those factors, a lot of those things that around social determinants of health and racism that's actually impacting our community.
So I was reading the report that the AG, Attorney General Healy, put out last week, I believe it was, and it talked about social determinants, the high numbers of communities of color, Chelsea, East Boston, that were testing positive for COVID-19, and relating that to another social determinant, so environmental factors like pollution. And as Councilor King was referring to a little earlier, we are disproportionately, Black folk and brown folk are disproportionately represented in those service industries that were essential workers, right? So that you're going out in multi-generational dwellings, you're living in those and nowhere to isolate. And then I heard our Surgeon General in the United States, tell folks, to don't involve themselves in risky behaviors like drinking. And a lot of folks took offense to, is this the reason why you think Black folks are disproportionately affected? So I am wondering, in talking about health disparities and us seeing this, because for some of us, this is not new. What are some things, and Councilor King and Rose, I'd love for you to join in on this piece, but I also want to talk about, we know this, so kind of how do we move forward? What are some things that we can talk about what are some things when these numbers come out that we probably already know about that we can do to kind of help to assist people in communities of color, particularly for this conversation, the Black community. I know Councilor King, you talked about local health centers being shut down in areas where poor and Black and brown folks are affected. But what do you see as some ways that we can right this wrong?
Well, I mean, some of the things that we're doing, in the medical school is that we're teaching the medical students about health disparities. They take a course about the social determinants of health. Right now, the medical school has a group that is actually going through the medical curriculum, and they're actually trying to take out pieces of the curriculum where race is thought of as a biological factor rather than a social construct. And so we're doing some things, at the medical school level to be able to train our doctors of the future to be able to think about racism and be able to identify, biases that we all have. And so, those are a few of the things that we're doing from the medical school side of things. I mean, other things that we can do within our community is, it's going to take an interdisciplinary team to really be able to right some of those wrongs that we're seeing as it pertains to COVID-19. And so it's going to take a multidisciplinary team of, physicians, of governmental officials, public health officials, and, just a whole team just to be able to come together and talk about, some of the things that we're able to pull together to help this community. I've actually been impressed. I've been working with individuals who've been diagnosed with COVID-19. I work in underserved communities, and so I work with individuals who are homeless, who have substance use disorder or severe mental illness, and I really have seen the community come together and pull together its resources to try to provide some support to those communities. I mean, there's a long ways that we need to go, but I think if we're able to work together, we're able to really address some of those health disparities that we're seeing.
And Councilor Rosen King, I know you have been advocating for that data, because with the data and the evidence, we can kind of move forward. Is there other things that you all are looking at right now that may be helpful in the more immediate future, like folk being able to get testing without, going through a long laundry list of symptoms or feeling like they may have to tell some untruths? Like friends of mine who just are feeling sick and just want to test. Are we looking at, New York now is making those tests available to more folks. What are we thinking about in Worcester? Is that going to be something that we can see happening in the next few weeks?
Again, I first want to make a comment.
Okay.
It really, the hair on my arm stood up when I heard the poor lifestyle choices. And it kind of plays in a little bit to what the systemic racism, the structural racism that the doctor mentioned. Is it really a choice? Do you have a choice to go to work or not go to work? Our folks who are those low wage earners, do they really have a choice, or whether or not they have to, figure out what their supports are so they can go to work for their kid who's home, who needs help with their education? Is it really a choice? And you talk about what can be done, at least on the elected official level. Mm-hmm. I think we can support and stand up, regardless of how popular it is politically, for things like increasing the minimum wage. I was arrested in that fight, something I stood forward and brought to the council, because it's important. Folks need to have that ability. We talk about homelessness and advocating for people, whether they're sober or not, to have a home base, so that the hierarchy of needs are able to be met, so they can engage in mental health treatment. Continue to advocate for that. And I think we have to do a job as elected officials to stand up and make sure it's in the media. It's part of everything we do. You think about the wealth gap as it relates to socioeconomic status or class. The wealth gap between Black America and white America, I think white America is somewhere around 10 times more in terms of that wealth gap. So, when you heard the doctor talk about educating, it's the same thing. In my field of social work, educating folks when it comes to labeling kids or families with DSM-4 diagnoses, not taking into account the cultural, societal, and economic interjects and comorbidity and all that stuff. I think we have to do more of that, you know, and be willing to try to pull your colleagues in. You know, one of the comments, there was a comment regarding some, you know, on the chat about reaching out to some elected officials who were not engaged in this issue. We need more of that. And here in the city of Worcester, we need more of a collective approach. We need the brown communities, the Black communities, the Native Americans. We need Africans and Black and African Americans and Puerto Ricans and Dominicans and everyone to show up. It's not often when there's an issue that we come together. And I think, you know, a lot of work can be done. You know, I know that Sarai Rivera has done a lot of work on this issue as one of our colleagues on the council with her community-based work. And, you know, there's a lot of poverty in Worcester. There's a lot. Yes, we're going through a renaissance, but there's a lot of poverty. There was a 24/7 Wall Street report that we were in the top 20 of folks of metropolitan cities as relates to poverty. You know, only other city in that group from New England was Springfield. So we have to do more to make access and opportunity for people of color. You know, and that doesn't necessarily, you know, speak to right now. As far as the right now goes, you know, the Worcester NAACP has been on this issue and partnered with me from the beginning. And what we've been talking about with them is also getting breakdowns of how many tests per day, where they're being administered, what areas in the city have the highest cases of COVID-19. And, you know, really trying to start targeting. Because if you look at it, you know, you wonder, you know, we have these folks showing up and protesting. You know, my wife and myself were verbally accosted about a week ago, right next to my house. I was with my 3-year-old. Someone jumped out of that car, ranting and raving that we need to open things up. The city's corrupt, et cetera, et cetera. And to a degree, I can understand some of it. You know, if you think about Douglas, Mass., they probably have 10 total cases. So if you have a business there, you're upset. City of Worcester has around 3,600 cases at this point. So I understand it, but we need to make sure that we're educating folks and we're willing to take the heat, you know, that will come with government, you know, trying to make sure that everyone's healthy.
Thank you for that. Councilor Rose, did you have a follow-up?
Yeah, I mean, I can certainly echo those sentiments. I think the minimum wage is huge. I think that, you know, growing up a poor kid on Section 8 with, you know, 2 brothers and a sister living in a 2-bedroom home, I don't know how, if one of us had it right now, how we would be able to isolate away from the rest of them. I don't know how my mom, who was working a bunch of jobs as a bartender and cleaning houses and doing these, working in a laundromat, would have been able to not assume the risk to bring it home to us, because that's our livelihood, that's putting food on our table. I think the minimum wage is certainly a thing, and I think education is a thing, and I think that people who are in leadership, persons of color and so on, really need to get out and start communicating in our schools. I've been in a lot of our schools, particularly those in our lower income communities, talking to the young people about the value in education. When I got out of high school, nobody told me that college was an option. Every person of color when I graduated high school was steered towards the military. Nobody in my household was talking about graduate school, getting a master's, getting a bachelor's. No one actually told me. I tell the story all the time. Councilor King and probably Maritza Cruz on here probably tired of me saying this, but I was told as a kid that I couldn't be a politician, that I could never be president, that those things weren't for us. I think there's an element of conditioning that we all need to sort of respect and take ownership of breaking some of that conditioning down. Now, as it relates to COVID-19, we have everything is going virtual. yet we don't have good analysis about what technology looks like in our lower socioeconomic class, for our lower socioeconomic classes. Do they have internet service? Do they have Chromebooks? Do they have iPhones? Do they have so on? So I think that the school department, we need to push them a lot around these things. Like, we don't realize that 42, 44% of our kids and of our 25,000 students are kids of color. And so I think that we need to certainly hit it on the reactive side and do all these things in the moment and plug away at certain things. But I also think that we need to do it organically through our schools and through our kids. And I think we need to show up in that sense. We need to identify areas like tobacco, for example, which UMass put out a big study where a lot of the tobacco was concentrated in our lower socioeconomic communities, in our Black communities, and that people are okay with that. We put up an order looking at capping the amount of tobacco industry so that we could have better accountability of them, for them when they're getting fined to be like, oh, that's okay, and pay the fine and keep selling to underage, to cap that so we could have more teeth in that ordinance so that we could kick them out and sort of move this map around in terms of where that concentration is. I had a resolution last night on, essential care workers, our direct care workers who are working 2, 3 jobs and oftentimes not even making minimum wage, but they have to continue to go to work to maintain their benefits. They don't have time off because their kids have been out of school forever, yet they're assuming risk to the virus. They've contracted the virus. In some cases, they're isolating in homes with the clients that they serve, or they're trying to quarantine at home away from their own families. Yet they're not in any commercials. No one's giving them any free meals. No one's drawing into their loans in our colleges like, thank you, direct care workers and group home staff. So I think that there are going to be, we're going to continue to plug away at some of these things. I tend to focus on the data a lot, Debbie, because I think it takes the emotion out of everything. And as we get more data through the chip and through these other things, I think that we're going to continue to plug away. But I can't reiterate enough about the need for the increase in minimum wage. And $15 isn't enough, let's be honest. It's a starting point, sort of. But people can't survive on $15 an hour. We need to do better than that. I know that Councilor King is willing to go to jail for that cause, but I'm with him on that. I think that the more needs to be done around that so that we can get people out of poverty, and I think we need to get them out of the mindset of this conditioning mindset that that I grew up with, that still exists in the city today.
I just also wanted to piggyback on what Councilor Rose was talking about, and first say that, Dr. Garcia wrote a comment on there regarding percentages of folks who were testing positive at some of the shelters that I referenced earlier. It's important for us to keep pushing, and it's as important. And trust me when I say this, and Councilor Rose will certainly support it, I'm sure. The folks on this call, your friends, your family, hold us accountable. When we don't hear from you, some of us, when some folks don't hear from our community, it's not an issue for them. Other folks are constantly, being global in their thinking. And when you get 5 or 6 emails on an issue, or 10 or 12, some folks, quantify that to be the equivalent of 200-300 people. So you may say it's only 3 or 4 emails or phone calls or text messages. It matters. Just as we push, we need to have folks to push with us. And again, it's how you get things done. And I certainly pledge to continue to be a part of moving things forward. And Maritza Cruz just mentioned the city COVID task force. I don't know who's on that task force. That's a communication issue on our side, which I will reach out and find out exactly what's going on there. particularly since we brought this forward. In regards to the Chromebooks and getting those things out to the kids and families, I know there has been some concerns about that. There are some gaps there, but there's also a lot of great work going on trying to get those out. But of course, we can always do better. I also want to just comment on, the doctor talked about the internalized racism, right? They talked about, how that happens. Well, it happens due to conditioning in society, right? Social conditioning. So you even think about, access to grocery stores, right? Depending on where you live in the city. When you think about, Whole Foods versus, My Price Chopper, and the types of food there and things that are available, and things that are, as far as good, healthy food and how much that costs. And, the whole system is rigged that way against people who are impoverished, or who have lack of opportunity, who are on a lower income scale, which are primarily people of color and Black and brown folks. So there's a lot to this. You engage with us, and we're going to push, not just the city. I have no problem reaching out to the congressmen and women of the state. I have no problem reaching out to our state elected officials. I'm also the chairman of legislative affairs and municipal operations, something I'm willing to do. And as far as the town hall, that's something I'm also interested to do. I've actually been in process of having some of those preliminary discussions with some folks. And the last thing, gender. We haven't mentioned it today. We know about the health challenges of Black men and of Black women, and of Black folks who don't identify one way or the other. But we also need to have those numbers as well, because it informs us, and it'll help us move through this and try to get folks to be more engaged with their clinical providers.
Wonderful. Thank you, Counselor. And thank you all for inviting us to be more active in the process, and inviting folks that are interested to participate in the process. And I want to, and I know Maritza Cruz and Kathy Esparza, you all are on this call. I want to get to you in a few minutes. And David, I'm going to ask you to unmute them in a little bit, because I know Maritza Cruz, who is Director of Gender and Race Equity at YWCA, also serves on many boards and commissions and committees. And one is this newly formed Equity Committee. And I'm not sure that I'm saying that correctly, but I'll let her, if she's willing, to speak about that a little bit and talk about who is on that committee, if she is able to share. I want to move, as we're talking about racism, I want to talk about and talk to a couple of folks on this panel that have been actively engaged in community and have been involved and have been part of, kind of solutions to issues. So one of the things that came up, and we're talking about a lot of intersections of race, gender, poverty, our unhoused families and individuals in Worcester. And we, of course, are talking about the schools and people having access to learning through Chromebooks. So I'd like to go first to Bill Gardner, who does a lot of things, but one of the things he does is he's a part of this wonderful concept and organization that developed almost immediately when COVID-19 hit, and that's Mutual Aid Worcester. So Bill, I'm wondering if you can just tell us a little bit about Mutual Aid Worcester, and I may have several other folks on here from Mutual Aid Worcester, but and tell us specifically what you've been involved with and your work right now, and how you've been working with the community in what area.
Sure. Thank you, Debbie. It's a pleasure to be here tonight. First, let me start off by saying that I'm not speaking on behalf of Mutual Aid Worcester, but rather as a private citizen who has learned quite a bit while working with the Mutual Aid Worcester Education Group, was where I kind of landed. Mutual Aid Worcester, like you said, started virtually immediately when this pandemic started, and we were all told that we were going to have to shut down our businesses and shut down the schools and things, and they've been really good. Right now, it's over 4,600 people as of yesterday that have gotten together, are in a Facebook group where they're primarily just fielding requests and requests for things, from formula to diapers to toilet paper to clothing to, whatever else, needs that pop up and aren't being readily addressed, in our community. We have folks that are just out there as volunteers, taking care of it. So it's a really amazing group. When I first started working with the education group, it became clearly evident that the remote learning going on in the city, in the schools, one, wasn't very robust, and two, a lot of Black and brown students were being left out because of a lack of technology or the internet in their households. And so when schools were initially closed, teachers were asked to reach out to their students, and packets of lessons were hastily put together and sent home. A lot of those packets never reached students. A lot of them were coming back. Eventually, plans were made to teach remotely, but because all students didn't have access to tech or the internet, they're told that, well, they won't be graded, which then caused a whole lot of other students to just stop doing work altogether, which is just very unfortunate. Or as we know, our children, children of color, they're often having to work themselves or having to take care of their younger siblings because their moms and dads are out working so that the family can survive, leaving them with little or no time to do their own schoolwork. On top of that, the remote learning, as it turns out, is mostly only access to a Google Classroom where kids will get the lesson and the homework in print online with very little or no actual contact with their teachers. And if they don't understand something, they then have to email their teacher and wait, sometimes hours, if not a full workday, for a response. So that is, of course, unless you are an advanced placement or AP student. From what I've been told, the Worcester School Department has bent over backwards making sure that those AP students have face-to-face access to their teachers just about every day of the week on Zoom calls like this one. And we know that traditionally our Black and brown kids are not taking those classes for one reason or another, which again is just an indicator of the racial gap. So at the end of the day, the education is certainly not equitable and definitely not nearly up to par with what they would be learning in an on-site classroom. Now, other schools in Worcester, albeit private schools and religious schools, have been having actual remote classrooms from the get-go. So why the public schools have not been able to do the same thing, we don't understand. They've been purposefully holding back on getting the school system's computers out to the kids for over 8 weeks now. We've heard everything from social distancing issues to smaller schools that better resources to what happens if we don't get the tech back. And they kept pushing out the date that they are actually going to distribute. So the question then must be asked, if the city can do food distribution across the city all week long, which has been great for kids that are in school and maybe can't afford to get 3 meals a day, why can't we hand out technology at the same time? A larger school system is nothing but a lot of smaller school systems all bunched together. And if those smaller systems can do it, why can't the public schools? For example, from the very beginning, Boston, Springfield, Fitchburg, and Holyoke, just to name a few, had all started programs to distribute technology to all of their students that didn't have it, most by the first week in April, and some even earlier. So 8+ weeks later, and the city is only just beginning this week to distribute the Chromebooks to the students after the state of Massachusetts finally pushed and upped their requirements to teach new material and not just keep the status quo. Furthermore, the city is advising, or the school department is advising, that they will only distribute 1 Chromebook to every 2 kids in the household. This was told by Superintendent Binienda last night or yesterday afternoon on a webinar with the Worcester Education Collaborative. And due to stay-at-home restrictions and the need for many parents to be working, that means 3, 4, 5 or more students are sometimes living together in any one location, and half the necessary devices simply won't be adequate. If you listen to the superintendent, you would think that they are doing everything possible to make this a smooth operation and that everything is just rosy. But if you speak to the many students and parents and teachers that I have, especially as a result of being part of Mutual Aid Worcester, you know that that's anything but true. The education is just a nightmare. There are a lot of kids that aren't being reached. There aren't a lot of kids that don't have tech. And so, as is usually the case, most of the kids going without or being left out are from poor households or children of color. So it's something that we need to take a very strong look at. And to be honest with you, I think that besides our health and safety and maybe food, educating our kids has got to be one of, if not the next most important thing. And I'm sorry, from where I sit, I see certain people in the city leadership, mostly in the Department of Education, that just aren't doing what we need to do to get these kids educated.
Thank you for that, Bill, and definitely looking at education as one of those other places that maybe is not as equitable, that determines like the path maybe you would take in life. As Counselor Rose was talking about expectations, that it's not expected, and a lot of us have those stories. It wasn't expected. Your school counselor would talk to you about going to matriculating, but instead maybe you can, take up a trade, or you can go to the military. So thank you for that. Thank you for the work you're doing. Craig Mortley, who is on the line, and like I said, it's important to me for a couple of reasons. I know you are a recent grad of Leadership Worcester, and so my question to you will be twofold. First of all, I want to know, I know your area of expertise and the work you do right now is in the area of domestic violence, at least one of the areas. So I want to talk a little bit about how COVID-19 has impacted folks in that community, folks experiencing domestic violence, and when you add being an immigrant of color or a person of color, not being able to access courts and things that institutions that are not readily available right now. Craig, can you talk a little bit about what you have seen in both your professional work and the work you do in the community? And then the second part of my question, I do want to know I think I have a couple of folks on here who recently graduated from Leadership Worcester class of 2020. Congratulations. Also want to know what leadership looks like around this. What role do you see yourself playing in this as leaders that are being nurtured in the city of Worcester?
It's a pleasure to be here and to have this very topical discussion, which I think is probably the first of its kind that we're having in the city. I'm glad that you mentioned the immigration and the immigrant piece to it. In our conversation so far, we've talked about Black people and people of color as a whole. But one of the things as a gateway city is that we have to sort of disaggregate the data that we're seeing, because not all Black folks experience this COVID-19 pandemic the same ways. And when we think of our LGBTQ plus population, the impact and the experience looks a whole lot different when we think of those folks who are experiencing domestic violence and living in homes where there is intimate partner violence happening. Then the experience looks a little bit different, and the interventions that are needed has to be targeted. So part of it, we have to also look on not just those hotspots, but also disaggregate and look on the various impacts that folks are having so that we can provide the support. So when we think of those folks who are experiencing domestic violence, and the normal, those folks are isolated. So add COVID-19 and the shelter in place, it adds to the isolation. Many service providers were able to move to remote access and to provide services remotely via telephone conferencing and video conferencing. The courts, after a while, was able to do the same thing. However, it took some time for that information to go out to folks. And so they were sort of left in a quandary to figure out what was still open, who are still providing services, and how to access those services. Then we think of the technology piece of it, that many folks might not have access to technology. Most people have a phone, but one of the things we don't think of sometimes is that some people have limited minutes. Not everybody has unlimited minutes. Not everybody has unlimited data package. It's sometimes shared data package, and to use those up to get services. For those folks who were sheltering in place with their abuser, it leaves the space for the abuse to escalate. And I've heard some conversations in the community about increasing domestic violence because of frustration, and to sort of clarify that piece that folks will get frustrated, and there will sometimes be arguments and disagreements, but that's separate and apart from domestic violence. Understanding that pattern of abuse that happens, and how being in that space, not being able to, some of the traditional avenues that were available to folks, such as getting a restraining order or going to stay with relatives, are not an option for them anymore. And so they are stuck in those places. When social services or doctor's appointment were sort of their avenues to get out and to get help, then because those services are being provided remotely, then it creates additional challenges for folks. So even for folks who were not sheltering in space with their abusers, think that they might have children, and many folks don't live in large houses where they can find, spaces for privacy. And therefore, even if they have connections to those domestic violence service providers, they might not have privacy to discuss the issues that they're experiencing at the time. Additionally, because basic needs for some folks who were laid off has become primary focus for them, many people have said to us as service providers, I can't deal with the abuse that I'm experiencing now because I have to figure out educating my children because I'm now their teacher. I have to figure out finding food because I have not been working. So it created additional barriers for folks. When the courts were open, in the beginning, folks still had to go to court to get these orders. Which then added another level of danger for folks, because you're going into court, you're not really going into the court building. They're giving you the paperwork and you're staying outside filling out those paperwork. You are calling in, and most people are calling in from the parking lot because they have to wait for their paper copy of the protection orders. And therefore, if you are being stalked or followed by the abuser, that leaves you very vulnerable being out there. Because many folks were concerned about having first responders like the police in their homes, many folks did not call the police. Outside of COVID-19, the Black population, African American population, had challenges with police response to incidents. So couple that with folks being afraid of their abuser being arrested and going into a facility, contracting COVID-19 and taking it back home to them. Additionally, the police were not arresting folks, and so sometimes they were letting them off with a warning. So they would call the police, and then the abuser is back in the home. That definitely creates the possibility for the situation to escalate. And so folks are in this sort of very precarious position. Do I try to cope with what's happening, or do I get help? And the help that I'm looking for is not the help that I need, and it escalates and worsens my situation. When you think of immigrant population, and how they feel connected to the city. And many of them might not have that connection to the city because they're newcomers and have not built up that social network. They're further isolated. And the few folks that they might have in their social circles, they're not able to get together to have that social connectedness that's there. Many of them, based on their immigration status, aren't able to get full health coverage. So in mass, you qualify for example, like asylum seekers, you qualify for insurance, but it's a supplemental insurance that you can only take to certain health centers. It's generally tied to a particular health center. So think of, they might not have access to testing if the medical facilities are doing more telehealth services, that they might not be able to go into those facilities to get medical treatment and coverage.
Thank you for that. Craig. I am thinking about recent events that have happened in the United States, just around the killing of Black men and women, and how exhausting it is to think about this pandemic, and at the same time, the killings have not stopped. And when the order came out from the governor, and this is really just open to panelists, that if you have an opinion about this or something you want to say about it, and we were told it was safe and you need to wear a mask. And for some folks in the Black community, right away, it's like, no, you're killing us for wearing anything. But then to tell specifically, and this is gendered in some ways, but again, Black and men and women are being killed, that you now want us to wear a mask. And for some folks in the community, we were like, that's a death sentence, if not from COVID-19, possibly from others, police or folks acting as police or making citizen arrests and that sort of thing. And like I said, for me, it's just been exhausting because the killings haven't stopped and we're dealing with a pandemic. Does anyone have anything? And we've talked about, the physical health, but the mental health, the toll it's taking on people's mental health. Consular Rose, you want to weigh in on that?
Yeah, Debbie, crime, I'm just going to stay on the city for 1 second here and just talk about, touch a little bit more on what Craig was offering, because I think it's important that we hold this with us a bit. So crime in the city is down by 60%. Domestic violence is up. Health checks, wellness checks are up. Dormant mental health issues that have been kind of under the surface in individuals are coming to the surface now. There's more concern about the mental health of folks in their homes. The domestic violence issue that Craig just referenced. I think one of the things that we really need to consider doing, and I think it needs to happen now with some urgency, is to create more of a trauma task force that is connected to the PTSD and trauma associated with this virus. To Craig's point, you're not going to call it a police officer on someone who is in your own home, right? Or what that might look like. We've been working hard to get all the hotlines, domestic violence, suicide prevention, so on. Our suicide numbers are up. They're hidden because of all the deaths as it relates to this virus, but they're up. There's a lot of trauma that's happening in these homes. You have obviously far less mandated reporters. And if you want to tell me that a teacher doing a virtual something with somebody is going to help support some mandated reporting, I would strongly disagree. So I think that we, Councilor King and I and others, really need to start pushing the mayor and the manager and even the superintendent towards creating a trauma task force that was needed before this to address some of the PTSD and trauma that's coming out of this. Because you're talking about trauma's impact on the body and the brain and the stunted developmental trauma. I mean, I could go on and on and on. If you look at any trauma study, and Dr. Bradford can attest to this too, any trauma study, the outcomes for folks who have experienced this type of trauma in their early ages are not good. Whether it's substance abuse, promiscuity, self-injury, suicides, and so on. So we need to get ahead of that proactively in advance. And then I'll close with something that Bill had mentioned, because it's just going to infuriate him a little bit, but I do want to put it on his radar, is that we have a number of collaborative programs in the city of Worcester. The collaborative programs aren't considered Worcester public schools. So in effect, they don't get Chromebooks.
Mhm.
Who are in these collaborative programs? There's got to be a voice for those folks. My wife is an assistant principal in one. We're working really hard to figure out how to address this issue there. But I feel like our collaborative programs, you know, your Abby Kellys and some of these others that aren't connected or under the umbrella of the Worcester Public Schools are not getting some of the same technology resources and academic resources as others are. And that's just yet another disparity that we need to overcome. Sorry for going off on a tangent on the trauma side, but Craig really got me going with that, because I think that that's something that really can't get lost in all this.
It is. And we are seeing an uptick in the number of helpline calls we're receiving for domestic violence. And I think Counselor King, you had mentioned, are there DV shelters available? They're what they were before COVID-19. They're full across the Commonwealth. We're dealing with that. There are, as Dr. Garcia, there is priority given to DV survivors. We're still always working that out because they may not be in their communities. And sometimes, you know, the trauma of dealing with DV, the trauma of COVID-19, and then the trauma of being uprooted and told you have to go to another area to live that's far away from your other support system. So we're always thinking about that and safety. So there is an uptick in that.
Some folks may or may not know, I've been a child protective social worker for over 22 years here in the city. And I can tell you, I'm also regional vice president for Central Mass for social workers. I can tell you statewide, citywide, reports for abuse and neglect have precipitatively dropped, extremely low. We anticipate a surge in reports at some point. I know that some of the district attorneys throughout the state, particularly the district attorneys of color or attorney of color, are focusing on this issue of domestic violence. And some of our, I was on a phone call with Ayanna Pressley, our congresswoman, who's also focusing on these issues. So forums like this are so important. When you talk about interdisciplinary teams, the doctor mentioned, that's part of it too. But those interdisciplinary teams needs to also be diverse.
Yes.
And of course, don't forget our social workers. So trauma is important. It certainly has an impact. I'm there with my colleague. And I also want to just touch upon the other part of your question, which is around safety for Black and brown people. The fact that we're discussing whether or not wearing PPEs, face mask, implicates the safety of young Black men or Black men in general, or Black women or Black people, tells all you need to know. My first comment, I've said this to my friends, my wife, brothers, sisters, cousins, guard against the numbness. Because I get numb. I don't even want to see the next thing on social media. I don't want to see, I don't want to hear. I avoid watching some of the Netflix movies, on some of the incarceration, and the whole nine. But we need to guard against that very numbness. It's self-preservation to a degree, but we need to get around to this is the reality of life. You can't jog, you can't walk, you can't have a licensed firearm. There's a whole bunch of things. You can't have Skittles. There's a whole bunch of things, that you can't do. And this, it really hits home right now, particularly with what's been going on as of recently, for Black and brown men losing their lives. And so, I didn't really think about it. My first reaction, I wanted to respond to that is, face mask or not, there's safety implications. And I think it's a matter, I always say that Worcester's changing. Our community's changing. Massachusetts is changing, right? The country's changing in good ways and bad ways. But we have to continue to be part of that fight, to be part of that change. So we're not even asking these questions. It's a legitimate question. I want to say it's a ridiculous question. I have a blue mask on my face. I got to be, well, it's all about, the work that we do with some folks, it's about who and how folks are responded to, and trying to get that out. And I think that's something I'll always pledge to do as a Black city councilor, no matter where I am. But that's real. I need to think about that a little bit more and chew on it. But it's definitely a concern. And as far as our community here in Worcester, I agree. We definitely need these numbers. The gentleman had mentioned earlier about the LGBTQ community, DV, the police not arresting. That's the catch-22. We have, situations where folks are incarcerated because they can't afford bail, on non-violent offenses. So, criminal justice reform is important. Perhaps this could have a bearing on that. Instances of domestic violence is a separate issue, as relates to that, but we need to really be clear about the messages that we're sending, because, it's like they say the devil can use the Bible for his purposes. So when we are interacting with authority figures, governmental figures, elected officials, etc., we as a collective, including myself, need to make sure that we're clear, repetitive, and of course passionate about what we're talking about, and don't allow the narrative to be shifted. I really appreciate this forum. I really do. Thank you.
And so, Councilor King, I'll be looking forward to you and Councilor Rose setting up something else, because several people have asked for a town hall. So maybe we can do that going forward. And this has been such a great discussion. Time is just going by so quickly. But I want to, we've talked about a few of the factors and a lot of good conversation around the disparate impact that COVID-19 is having in the African-American Black community. But there's a face to this. We're talking about this. There are real people who are experiencing this. And Bonetta, Bonetta, are you there?
Yes.
Okay, great. So what I want to do prior to us coming on, we were having a great conversation with Bonetta and Kofor and Dr. Bradford. So I want to kind of wrap things up with you telling us a little bit about your experience having tested positive with COVID-19 and thankfully in recovery now from that. And just some, then Dr. Bradford, I also like for us to kind of end this with things for folks to think about. We talked about testing. Is testing, are we assured 100% that we're absolutely negative? And what are some things, that folks can do to kind of, what should they look out for, and how we can take care of ourselves. So Bonetta, if you don't mind, tell us what you feel comfortable telling us about your experience with COVID-19.
Okay, so I'll try to be as brief as possible. I would really like to have Dr. Bradford have her final words, but I self-quarantined well before I got the virus. Maybe went out 4 or 5 different times for less than 4 hours. And I was doing everything possible. I washed my hands till I became ashy. I washed all my walls down. I disinfected, I sterilized, and I was fine. And then all of a sudden, I found myself laying on the bathroom floor. Don't know how long I had been there, but had been there for quite a while. And I decided maybe at that point I would call the doctor. I also realized that my daughter told me I had been sleeping for about 4 days. I would wake up, maybe take a bite of food, and then lay back down. But I really wasn't aware of my surroundings. I wasn't eating, I wasn't taking my medications. One thing I wanted to say very quickly is I had had a sore throat for about 2 weeks. And I called my doctor's office asking if I could be tested. I'm 70 years old, I'm a diabetic and other underlying conditions. And my immune system stinks. So they said, well, no, you don't need to take the test. And I'm like, okay, I can't make somebody test me if they don't agree to it. But after I passed out and called them and told them that I hadn't been on any of my meds, for a diabetic, that's not a good thing. Then they decided to test me. And they said I was positive. They actually called me back the same day and said I was positive. When I got home, I continued to keep sleeping. I couldn't stay awake. I couldn't eat. I didn't have any problems with not tasting food. Everything, all the liquids that I drank all tasted the same, which was very weird. And my symptoms, I didn't have any breathing symptoms, although I'm asthmatic. I had problems with cramps in my stomach, and they were consistent every day, all day. And so my doctor and I did teleconferencing, and he told me that I looked like I was very ill. He was concerned. My biggest fear in that conversation with him is I don't want to go in the hospital, because I had heard so many different things about being in the hospital. I'm very much aware of doctors and how they treat patients of color. I'm actually a standardized patient at UMASS at ICEL, so we're working with young doctors on helping them become more aware. And I thought of all those things, and I thought, if I'm going to die, I'd rather die at home. I know that sounds stupid, but as a person of color, a woman of color, if you didn't understand that when I told you I had a sore throat and I was a diabetic at the first phone call, why did I have to pass out in order for you to pay attention to that? So in my opinion, I don't have the virus, but I don't know, because Dr. Bradford addressed something around positive and negative testing, but I haven't had any issues around cramps in my stomach for well over a week or longer. So I don't want to hold up everything, because I really want to hear what she has to say, but I will say this to you, that we have to pay close attention. This is not a joke. This is really not a joke, and I probably will be living with a face mask for quite some time, maybe longer than other people. I fear going out and connecting with other people. You know, maybe I might be, I just don't want anybody to get sick because of me, you know, and I also fear people not wanting to be around me because they think I still may have it. And so I just pray for the African-American community, people of color, the Black community, which includes Islanders, Africans, and Black Americans. We have to come together as a united force to figure out a way how we can help our people. But we also have to remember that the people that I'm talking about are culturally different in their understanding of how things happen and why they should wear a mask or why they shouldn't wear a mask. So on that note, everyone, thank you for that opportunity, but maybe Dr. Bradford can talk about the negative, positive piece.
Yeah. Thank you, first of all, Bonetta, for being willing to share that story with us. And it's helpful to know that we know the symptoms that everybody's talked to us about, chills, difficulty breathing, but yours showed up in a little bit in a different way than we wouldn't expect. So Dr. Bradford, thank you so much for doing it. Dr. Bradford, can you talk a little bit about, just in wrapping up, again, reiterating things to look for, but also talking about testing, how accurate is the testing right now, and who can get testing, and what we should do to keep ourselves safer, at least.
First of all, I'd just like to thank Bonetta for sharing with us your story, you know, as a patient. I think it was really powerful when you said, I'd rather die, if I die, I'd rather die at home. I think, you know, over and over again, we're seeing in the media, on the news, that, you know, Black individuals are dying of this disease at home, and once they get to the hospitals, their symptoms are pretty severe. And so, you know, I think the concern that I have is that, well, you know, I think it's important information that we know that this disease is disproportionately affecting Black people. I also want individuals to not wait until they're so sick that once they get to the hospital, then, you know, their symptoms are severe. And I know that there's, you know, like historically, there's a distrust within the Black community regarding medical care, but I think it's just really important for us to not, you know, take that internalized racism and say, you know what, I'm not going to go to the hospital. They're just going to treat me poorly. They don't care about me. And I mean, there's instances where, you know, where physicians and medical community need to step it up and treat individuals fairly and with respect. But, you know, it's important for the Black community to go to the, to get seen if you think that, you know, your symptoms are becoming more severe. As far as testing is concerned, there's been larger conversations in the community of increasing the amount of testing that we are providing the community. Of course, that's sort of a double-edged sword. As far as the test is concerned, about 30% of people who test negative may actually have the disease. And so there's individuals who are asymptomatic. There's an individual that is symptomatic who get tested and still test negative. That being said, if a person does test positive, then, we're able to pretty much assume that that test is correct. So some things that we could do is, of course, things that the CDC has already has presented to us, washing our hands, making sure that we socially distance ourselves, wearing masks when we go outside, and we can't maintain a 6 feet of distance between ourselves and other people. And then being vigilant of symptoms. You can monitor your symptoms, checking your temperature. If it's 100 and above, you can call your physician, or if you have symptoms of sore throat, cough, muscle aches, changes in taste and smell. And there's a whole list of other symptoms that are on the CDC website that you can check out. If any of those symptoms have come up, then you can reach out to your healthcare professionals, or if you are experiencing severe symptoms, and going to the emergency room to get seen.
The doctor mentioned delayed medical care, delayed medical assessment. It hit a note for me. I'm probably guilty as charged, not during the COVID, but just generally my age, I need to be into the doctor. There's some cultural things there. There's some fear there. I think some human nature. There's not a lot of doctors, who have what's the word there? Melanin of our good doctor who's on call. And I hate to say this, but I'm gonna say it anyway. We need to see more folks who look like us, who are in these medical positions. Not just as nurses, nothing wrong with nurses, but nurse practitioners, doctors, epidemiologists. And if there's a way that, we can spark the interest of one kid, one young person, one person in our schools, one person right now who's looking at their family member who's suffering, to say I can, as Councilor Rose mentioned. I never thought I'd be sitting here as doing anything with politics. Never thought Barack Obama was going to win, matter of fact. That we can, and then we can do it. And if there's a way for I've been looking for Black doctors in the city. I'm aware of a couple. But if there's a way that we can, as a community, engage with them or bring a large group of folks, I'm not talking about career days where they're bouncing around, not wasting time, but in one particular school with 6 kids, if there's a way that we can help bridge that gap and a way to allow people to dream, I think that's something we can all collectively do in the now, and moving forward is trying to engage with our folks in the medical profession who look like us, to be visible, just like our elected officials.
I think that's a good idea. And I know we have quite a few people here from different organizations on this conversation, this virtual meeting. And so NAACP, Massachusetts Women of Color Coalition, and others, definitely I'll put Worcester Black History Project out there to kind of see if we can collaborate and coordinate and get some events planned. I was given a list of folks that are part of the testing access and data outreach. And, I don't want to say I can tell by names, but some of these folks I know, and I just think it's important that we are represented. Black and African American folks are represented on these committees, and we need to pay attention, and definitely, in collaboration with other groups of color, making sure that your voices are heard. So thank you everyone for being part of this. Folks on the panel, thank you so much for showing up for this important conversation. And I appreciate you. Thanks for answering the call. And folks that were listening in, I wish we had more time. This went by so quickly and so much that was discussed that was so important. But maybe we'll have another conversation at another time. So thank you to all the panelists again, counselors, doctors, Phil, Craig, Vanetta, thank you for sharing your story once again. And we're gonna close it out now. Take care, everyone. We'll see you soon.
Thank you guys
Thank
very
you.
much.